All right, so today we're really going to dive deep into this whole idea of type 2 diabetes,
Okay.
but not in the way you might be used to hearing about it.
Mm-hmm. Yeah.
You're looking for some alternatives, and I think that's where this book, The Diabetes Code by Dr. Jason Fung, really comes in.
Yeah.
And it challenges a lot of the conventional wisdom around type 2 diabetes.
Right.
So what are some of the things that really stood out to you about this book?
Well, one of the most fascinating things right off the bat is this idea that type 2 diabetes might not actually be this like chronic progressive disease,
Oh, wow.
that we've always sort of been told it is.
Right.
Dr. Fung presents a very different perspective on the root cause. And
Okay.
yeah, it's really intriguing.
And he kind of paints a pretty stark picture, too, of the global diabetes epidemic.
Yeah,
I mean, just the statistics alone are pretty mind-blowing.
absolutely.
Did you know that the diabetes rate in China has skyrocketed by like over 1,100% in just one generation?
It's crazy, isn't it?
It's insane.
Like in a single generation,
Yeah.
it's really alarming. And I think it really sets the stage for,
Yeah.
the urgency of this problem
Yeah.
that we're facing.
Yeah, it's not just a few people here and there. This is
Nah.
like a global health crisis.
Right.
And it goes beyond just numbers, too.
Yeah.
Dr. Fung really highlights the impact on individuals, like how type 2 diabetes can actually affect every single organ in the body.
Mm-hmm.
That was something that I didn't really fully grasp before reading this book.
Yeah, it's pretty comprehensive,
Yeah.
the way he goes through it.
Yeah, and he even links it to a higher risk of dementia,
Right.
which I had never really considered before.
That's something that's not often talked about,
Yeah.
but the research he presents is pretty compelling.
Yeah.
It's a connection that a lot of people aren't aware of,
Mm-hmm.
but it's definitely something to be aware of.
Yeah, for sure. And he really details all the different potential complications like blindness,
Mm-hmm.
kidney failure, heart disease,
Mm.
even amputations.
Yeah, it's really sobering.
It is.
It kind of makes you stop and think like, wow, this
does.
is serious stuff.
This is serious stuff.
Yeah.
And especially since you're specifically, looking for ways to manage this condition without relying solely on conventional treatments.
Mm-hmm.
Well, Dr. Fung's approach is definitely unconventional.
Yeah.
He claims that the root cause of type 2 diabetes isn't actually high blood sugar, but something called hyperinsulinemia.
Right.
Have you heard of that before?
I had heard of it, but I didn't really understand it fully
Okay.
until I read this book.
Yeah, because I was like, hyper what?
Yeah, it's not a term that's,
That's commonly used.
thrown around a lot, but it's really crucial
Okay.
to understanding his whole theory.
Yeah.
So hyperinsulinemia basically means chronically elevated
Okay.
insulin levels.
So instead of the problem being not enough insulin, like in type 1,
Right.
he's saying it's too much insulin.
Too much insulin.
That seems counterintuitive. Like,
Yeah.
how does that even work?
So what he argues is that our bodies develop insulin resistance
Okay.
as a defense mechanism against this constant overload
Okay.
of glucose and insulin.
Okay.
So it's like your cells are putting up a barrier to protect themselves from being flooded with sugar all the time.
Oh, so I'm picturing like my cells are putting up a keep out sign.
Right.
Like we're full.
We're full.
We don't need any more sugar.
Exactly.
But then what happens?
Well, when the cells resist the insulin,
Okay.
the pancreas just pumps out even more insulin,
Okay.
trying to force that glucose into the cells.
It's like a vicious cycle.
It is a vicious cycle.
It's like pushing a square peg into a round hole.
Exactly. It's like, trying to squeeze a gallon of water into a pint glass.
Yeah.
Eventually, something's got to give.
Right. Something's got to give.
Yeah.
So where does our diet fit into all of this?
Well, that's a big part of it.
Yeah.
Dr. Fung places a lot of blame on refined carbohydrates.
Okay.
And fructose in particular.
Okay. And so when we talk about refined carbohydrates, we're talking about like the white bread,
The white bread.
the pasta.
The white rice.
Yep. All that stuff
All that stuff
that we love.
that we love.
Yeah.
But that's not doing us any favors.
And then fructose. So that's just the sugar found in fruit?
It is naturally found in fruit, but the problem is we're consuming it in such high quantities these days.
Okay.
Mainly in processed foods and sugary drinks.
Okay.
Yeah. High fructose corn syrup and all that.
Right. And he says that fructose is metabolized differently
Right.
in the liver than other sugars.
Exactly.
And it can lead to increased fat production.
Particularly in the liver.
So wait, you're telling me all that pasta and bread I love could actually be turning into fat in my liver?
It's a possibility.
Okay.
And it's a key part of his argument.
Interesting.
He talks about this process called de novo lipogenesis,
Okay.
or DNL for short.
Got it.
And it's basically the process of your body turning excess carbs, especially fructose,
Correct.
into fat,
Okay.
primarily in the liver.
So some of that pasta might be contributing to a fatty liver,
Potentially.
which can then worsen insulin resistance?
Yeah,
It's all connected.
it's all connected.
Wow.
So that's something to think about.
This is where you need to be careful and take a close look at your own diet.
Absolutely.
Like, how much fructose are you actually consuming?
Right.
Because Dr. Fung argues that this overload of refined carbs and fructose is really what sets the stage for hyperinsulinemia
Sets the stage for the whole thing.
and ultimately type 2 diabetes.
Exactly.
But what about all the conventional treatments out there?
Right.
Are they actually helping, or are they just kind of masking the problem?
That's the big question.
Yeah.
And it's something that Dr. Fung really takes on.
Okay.
He argues that a lot of the standard medications for type 2 diabetes, while they might lower blood sugar in the short term,
Okay.
could actually be making the underlying problem of hyperinsulinemia worse.
So he's specifically talking about medications like insulin,
Insulin.
TZDs, and SUs.
Yes, those are some of the ones he highlights.
Okay.
Because they essentially work by forcing more glucose into already resistant cells,
Okay.
which can lead to even higher insulin levels
Oh.
and potential side effects like weight gain.
So it's like treating the symptom,
Right.
high blood sugar,
Exactly.
without actually addressing the root cause,
The root cause.
the hyperinsulinemia.
The hyperinsulinemia,
It
exactly.
seems kind of backwards.
Yeah, it's kind of like putting a Band-Aid on a bullet wound.
Right.
You're not really solving the problem.
Yeah, that's all in the problem.
You're just kind of covering it up.
Yeah.
And Dr. Fung suggests that medications like metformin
Okay.
and SGLT2 inhibitors,
Okay.
which can actually lower insulin levels,
Okay.
might be better options in some cases.
Interesting.
And these medications have shown some promising cardiovascular benefits as well.
That's good.
Yeah.
But ultimately, he's advocating for a more natural approach to lowering insulin and reversing type 2 diabetes.
Exactly.
And that's where intermittent fasting comes into play.
That's the big one.
Okay, intermittent fasting.
Yes.
We hear that term thrown around a lot these days.
We do.
But how does it actually work
Yeah.
in the context of reversing type 2 diabetes?
So what Dr. Fung explains is that fasting gives your body a chance
Okay.
to deplete its stored glucose, which is called glycogen.
Okay.
So it's like emptying the sugar bowl, so to speak,
Right.
allowing your insulin levels to drop
Okay.
and your body to kind of reset its insulin sensitivity.
So it's like giving your pancreas a much-needed vacation.
Exactly.
Oh.
It's like saying, okay, you've been working overtime.
Yeah.
Now it's time to take a break.
Time to chill out.
Relax.
Yeah.
Recharge.
And he provides some pretty compelling anecdotes
He does.
from his own practice
Yeah.
about patients who have successfully reversed their type 2 diabetes through fasting. And I think these stories are really what make it hit home for people.
Absolutely.
Like, you can read all the science you want, but when you hear about real people
Real people.
who have actually done this and had success,
Yeah.
it makes you think twice.
Yeah, it makes it real.
It makes it real.
You know, it's not just theoretical anymore.
Right. And he talks about people who were able to get off their medications,
Right.
lower their blood sugar to normal levels, and really improve their overall health dramatically.
Yeah, and sometimes in a very short period of time, which is amazing.
It is amazing.
Yeah,
But let's be honest, the idea of fasting can be pretty intimidating
it can be.
for a lot of people.
Yeah,
And, you think about like starvation mode,
right.
the worry about losing muscle mass,
Yeah, all those fears
all those fears.
that come up.
Yeah. Does Dr. Fung acknowledge those fears?
He does. He addresses them head on.
Okay.
He uses scientific research to debunk those myths.
Good.
And he explains that fasting, when done correctly,
Right.
actually helps to preserve lean mass.
Yeah.
Okay.
And can even boost your metabolism.
Interesting.
Yeah. So it's not about starving yourself.
Right.
It's about giving your body a break
Right.
in a strategic way.
And of course, he emphasizes that it's crucial to consult with your doctor
Yes. Always.
before making any major dietary changes,
Absolutely.
especially if you're currently on medication for diabetes.
Especially if you're on medication.
Yeah, safety first.
Safety first.
Absolutely.
Yeah.
But it sounds like he's presenting a message of hope here.
He is.
That type 2 diabetes isn't necessarily a life sentence. Not something you just have to accept and live with. You can actually potentially reverse it.
You have the power to change it.
That's powerful.
It is.
And he believes that we could even eradicate type 2 diabetes.
Within a generation.
Within a generation.
That's a bold statement.
That's a bold statement.
But he believes it.
But he backs it up.
He does.
With evidence.
He does.
He references successful studies.
Like the China Docking Diabetes Prevention Outcomes Study.
Yeah, that's a big one.
Which showed that lifestyle interventions led to a significant reduction in diabetes risk.
Yeah, 43% reduction.
Wow.
Which is huge.
That's huge.
Yeah.
So it's not just wishful thinking. There's actual proof.
Real world proof.
That prevention is possible.
It's possible.
And that's incredibly empowering for anyone facing this diagnosis.
Right.
Because it gives you a sense of control.
You're not a victim.
Yeah, you're not a victim.
You have agency.
You have agency. You have the power to make choices.
Yes.
That can positively impact your health.
Absolutely.
So to recap here, we've established that type 2 diabetes might be reversible.
Right.
That hyperinsulinemia is the potential root cause.
The root of the problem.
And that intermittent fasting offers a possible solution.
Yes.
But how do you actually put these ideas into action?
That's what we're going to talk about next.
Exactly. All right, let's take a quick break, and we'll be right back.
Sounds good. And the good news is Dr. Fung doesn't just drop this bomb on you and say like, hey, good luck figuring it out.
Right, right.
He actually lays out a plan.
Okay.
You know, he gives you a roadmap for how to implement intermittent fasting into your life.
So he actually gives you some practical steps.
He does.
A follow.
Yeah, he talks about different types of fasting.
Okay.
He even gives you sample meal plans to get you started.
That's helpful.
It is, because I think a lot of people get overwhelmed when they hear about these concepts.
Yeah, you're like, okay, I get the theory.
Right.
But like, how do I actually do it?
Exactly.
So does he talk about different approaches to fasting?
He does.
Because I know I've heard there are like a few ways to do it.
There are, and he outlines a few different ones, like alternate day fasting.
Okay.
Which basically you eat normally one day and then you fast completely the next day.
Whoa. Okay, that sounds a little intense.
It can be pretty intense.
I don't know if I'm ready for that.
That's not for everybody.
Yeah. What about something a little more beginner-friendly, shall we say?
Well, he also discusses time-restricted feeding.
Okay.
Which is more about, you know, limiting your eating window to a specific number of hours each day.
Okay.
So you might say, eat only between 12 p.m. and 8 p.m.
Okay.
And then you fast for the remaining 16 hours.
Oh, that sounds more manageable.
Yeah.
It's like pushing out breakfast and having an early dinner.
And it kind of extends the overnight fasts that you're already doing naturally anyway.
Right, right.
So it's not as big of a leap.
Right, and it still allows for like a good chunk of fasting overnight while you're sleeping.
Exactly.
Which gives your body a chance to like rest and reset.
Exactly.
It's like hitting the reset button on your insulin sensitivity.
Exactly.
But he emphasizes that, you know, it's not one size fits all right.
Right. It's not a magic bullet.
Right.
You have to find what works best for you.
Right. So you really have to listen to your body.
Listen to your body.
And find that sweet spot.
Yeah, and work with your healthcare provider.
Of course.
To personalize your plan.
Yeah.
Especially if you're on medication.
Safety first.
Safety first, always.
Okay, so we talked about fasting.
Yeah.
But you mentioned earlier that Dr. Fung, like, really challenges the conventional dietary advice.
He does.
For type 2 diabetes.
He goes against the grain.
Yeah, it seems like he really takes issue with the low-fat, high-carb diet.
He calls it illogical.
Really?
Yeah.
That's been recommended for so long.
He's like, why would you tell people with high blood sugar to eat the very foods that spike their blood sugar the most?
It's so true.
Yeah.
Like white bread, pasta, rice.
Yeah. All the refined carbohydrates.
Those are all things that like
break down into sugar.
Quickly turn into sugar in your bloodstream.
Exactly.
And hasn't there been a lot of research lately debunking that whole fat is bad idea?
There has been.
Yeah.
Like the Nurses' Health Study, the Women's Health Initiative, those big long-term studies found no direct link between dietary fat and heart disease.
Yeah, and he argues that we've been focusing on the wrong macronutrient.
Yeah, we've been demonizing fat.
Yeah.
When really it's the refined carbs and sugar that are the bigger problem.
So if we're not supposed to be afraid of fat, then what should we be eating?
What does Dr. Fung recommend?
Yeah. What does he recommend?
Well, he advocates for a diet that's rich in healthy fats,
Okay.
moderate in protein, and very low in refined carbohydrates and sugars.
So it's basically like flipping the traditional food pyramid on its head.
Exactly. It's turning it upside down.
So more avocados and olive oil.
Yes.
Less pasta and bread.
Basically,
Yeah.
he emphasizes whole unprocessed foods like vegetables, fruits, nuts, seeds, healthy oils.
That makes sense.
It does.
It's like going back to basics.
Yeah, think about what humans ate for centuries
Yeah.
before processed food became so prevalent.
Right. It's like a more natural,
A more natural.
ancestral way of eating.
Exactly.
So it sounds like Dr. Fung's method is like this two-pronged attack.
It is
You've got the intermittent fasting.
to lower insulin levels.
Okay.
And then you've got the low-carb, high healthy fat diet
Right.
to minimize those triggers that are
Right.
spiking your insulin in the first place.
So it's like a 1-2 punch
It is.
to knock out type 2 diabetes.
You got it.
And this combination, he says, can have a really powerful impact
A powerful impact.
on reversing the disease.
Yes. And he's got the case studies to prove it.
Okay.
You know, he shares stories of patients who have had remarkable success with
Yeah.
this approach.
They were able to get off their meds,
Get off their medications,
normalize their blood sugar.
lose weight,
Wow.
improve their overall health.
That's pretty incredible.
It is.
But I imagine it takes a lot of,
Effort,
commitment.
dedication.
Yeah, to really make these changes.
Yeah, it's not a quick fix. It's a
Right.
lifestyle change.
Right.
But he is realistic about the challenges.
Right.
You know, he acknowledges that it's not easy to overhaul your eating habits.
Right.
And, incorporate fasting into your routine.
And he's not expecting people to be perfect.
No, he stresses that it's not about being perfect.
Okay.
It's about making progress.
Progress, not perfection.
Right, exactly.
Uh,
And even small changes can make a big difference over time.
That's encouraging.
It
To
is.
hear,
Yeah.
you don't have to do everything perfectly
Right.
right from the start.
It's a journey. It's about taking small steps.
And he gives you tips along the way.
He does. He provides a lot of practical tips and strategies for dealing with things like hunger pangs
Oh, yeah.
and cravings.
Because I imagine those are pretty inevitable.
They are when you're making big dietary changes.
Yeah.
Your body's going to resist at first.
Yeah, for sure.
But he gives you ways to cope with that.
That's good.
Yeah.
So we've talked a lot about treatment.
Yeah.
But what about prevention?
That's key.
Yeah. Does he believe that type 2 diabetes can be prevented altogether?
He absolutely does.
Okay.
He argues that by adopting a healthier lifestyle early on,
Okay.
particularly focusing on diet and exercise,
Okay.
we can significantly reduce our risk
Okay.
of developing this disease.
So it's not just about reversing it.
Right.
If you already have it.
It's about preventing it
It's about stopping it
in the first place.
before it even starts.
Exactly.
And he brings up that study from China again, right?
The Dak King study
Yeah.
that showed that lifestyle interventions
Right.
were so effective
Right.
at preventing diabetes.
So that's like real world evidence
Real world evidence.
that prevention is possible.
Yes, it's not just a pipe dream.
It's so powerful to know that
It is.
we don't have to just accept this
Right.
as an inevitable part of aging.
Yeah, you're not a sitting duck.
Yeah.
You have the power
You have power
to
to
make choices,
make choices
to protect your health.
and to prevent this disease from ever happening.
Yeah.
It's like taking control of your destiny.
It is.
Now, there's one more thing I wanted to touch on.
Okay.
And that's this idea that he challenges the very notion that type 2 diabetes is a chronic
Chronic?
and progressive disease.
He does.
So wait, are you saying he believes that it's possible to completely reverse it?
That's exactly what he's saying.
Not just manage it,
Not just manage it,
but actually reverse it
reverse it.
so that it's like you never even had it.
Potentially, yes.
That sounds almost too good to be true.
It does.
Is there really evidence to back that up?
He presents quite a bit of evidence.
Okay.
He dives into research, real-world case studies
Right.
that suggest it's possible
Yeah.
to achieve long-term remission
Remission.
from type 2 diabetes.
That's a powerful word.
It is.
Remission.
Yeah.
So he talks about patients who have been able to stop taking all their medication,
Right.
achieve normal blood sugar levels, and maintain that
For years.
for years.
Just by adopting these lifestyle changes.
Wow, that's amazing.
It is.
It really speaks to the body's ability to heal itself
The body's incredible.
when given the right conditions.
It really is.
It's so powerful.
And this really challenges that conventional wisdom
It does.
that type 2 diabetes is a life sentence.
Yeah, it's like a whole new paradigm.
It is a paradigm shift.
Yeah.
And I think that's what makes Dr. Fung's work so compelling.
It's hopeful.
It's
It
hopeful.
gives you a sense of possibility.
Yeah.
It's empowering.
He's saying you have more control
Yeah.
than you might realize.
Over your own health.
Over your own health destiny.
Yeah. It's not just something that happens to you. It's
Right.
something that you can actually have a say in.
Absolutely.
It's a big shift in thinking.
It is.
So the diabetes code really presents like a pretty radical approach
It's radical.
to type 2 diabetes.
It's revolutionary.
How do we even begin to apply these concepts to our own lives?
That's a great question.
Yeah.
And thankfully, Dr. Fung gives us some guidance.
Okay.
So let's explore that in the final part.
Let's do it. Okay, so we've covered so much ground here.
We have.
Dr. Fung's given us a lot to think about.
He has.
But let's get down to like the practical steps.
Okay.
You know, you came to this deep dive.
Yeah.
Looking for answers.
Mm-hmm.
Specifically for alternative approaches.
Right.
To managing type 2 diabetes.
Absolutely.
So what are like the things you can actually do?
Yeah, what can you do starting today?
Yeah, like how can you put these ideas into action?
So I think the biggest thing to remember is that central idea
Okay.
of hyperinsulinemia.
Right.
Dr. Fung's whole approach really hinges on lowering those insulin levels.
Okay.
And he gives us a lot of concrete strategies to do just that.
And I think one of the most powerful tools is intermittent fasting.
It is a powerful tool.
I have to admit, I'm still a little intimidated by the whole concept.
Yeah, it can be a little daunting at first.
Yeah.
But he breaks it down in a way.
It makes it feel more approachable.
Okay, good.
And he emphasizes, you know, there are different approaches to intermittent fasting.
So it's not like a one-size-fits-all.
It is not one size fits all.
Okay, good, because I'm already feeling a little bit better.
Yeah, you find what works for you.
Okay.
So he talks about alternate day fasting,
Right.
which is basically where you switch between eating normally one day and fasting completely the next.
Okay. I'm not sure if I'm quite ready to jump into something that extreme.
Yeah, that's not for everybody.
Yeah.
But he also talks about time-restricted feeding, which is more about limiting your eating window to a certain number of hours each day.
Okay.
So you might eat all your meals between, say, noon and 8 p.m.
Okay.
And then you fast for the remaining 16 hours.
Oh, that actually sounds manageable.
Right. It's like pushing out breakfast and having an early dinner.
Exactly.
And it allows for a good chunk of that fasting to happen overnight while you're sleeping.
Right.
So it's not a huge leap. And it gives your body that time to rest and reset.
Exactly.
But he does say, you know, make sure you work with your doctor.
Oh, absolutely.
To personalize your plan.
Especially if you're on medication.
Right. Safety first.
Safety first.
Okay. So fasting is just one piece of the puzzle here.
One piece.
He also advocates for a pretty significant dietary shift.
He does.
Doesn't he?
Yes.
So remember how we talked about refined carbs and fructose being like the major culprits?
They're the troublemakers.
Yeah, and spiking those insulin levels?
Yeah.
Well, he really recommends cutting back on those dramatically.
Big time.
Okay, so less pasta, less bread.
Less sugary drinks.
Sugary drinks, all the good stuff.
Yeah.
So it's about swapping out the quote-unquote good stuff.
Right.
For the things that are actually good for you.
The real good stuff.
Yeah. So he wants you to focus on whole, unprocessed foods.
Lots of veggies.
Veggies, fruits, nuts, seeds.
Healthy fats.
Healthy fats like olive oil.
Avocado.
Avocados.
Yeah.
It's like a more natural
Same. A more ancestral way of eating.
way of eating.
Yeah.
Yeah. So this dietary shift combined with intermittent fasting can work together.
They work synergistically.
Yeah. To lower those insulin levels and reverse that insulin resistance.
It's the goal.
And it's not just theory, right?
No, he's got the proof.
He's got like case study after case study.
He does.
Of people who have achieved some pretty incredible results.
It's pretty remarkable.
Using this approach.
Yeah.
They've normalized their blood sugar. They've lost weight.
Gotten off their medications.
Wow.
And just dramatically improved their overall health.
That's so inspiring, especially for someone like you who's looking for alternatives to those conventional treatments.
Yeah. It shows that there's hope.
There's hope.
And that you have more control than you might realize.
Over your own health.
Yes, absolutely.
And even if you know you're not ready to make such like drastic changes right away, he emphasizes that even small steps can make a big difference over time.
Yeah, don't get overwhelmed.
Right.
Just start with one thing.
One thing.
Maybe cut back on sugary drinks.
Okay.
Or incorporate a short daily fast.
Okay.
You know, baby steps.
Baby steps progress, not perfection.
Exactly.
So as we kind of wrap up this deep dive into the diabetes code, what are the key points that you want our listener to really remember?
Well, I think the biggest takeaway is that type 2 diabetes may not be
Okay.
the inevitable chronic disease that we've always been told it is.
Right.
Dr. Fung presents a very different perspective,
Mhm.
suggesting that it's actually a reversible condition.
And that the root cause is likely hyperinsulinemia.
Yes, not just high blood sugar,
Right.
but the underlying issue of too much insulin.
And that the solution lies in addressing that hyperinsulinemia
Exactly.
through lifestyle changes.
Lifestyle changes are key.
So specifically, intermittent fasting and a low-carb whole foods diet.
That's the recipe.
So the diabetes code is really a call to action
It is.
to rethink our approach to this global epidemic.
It's a paradigm shift.
It's empowering
Yes.
to take control of your health
Yeah.
and rewrite the narrative of type 2 diabetes.
Absolutely.
And ultimately, it's a message of hope and possibility
Possibility.
and freedom
Freedom.
from a disease
Yeah.
that has really touched so many lives.
So many lives.
So as we conclude this deep dive,
Mm-hmm.
we leave you with this final thought.
Okay.
What if the key to preventing and reversing type 2 diabetes lies not in a pill,
Okay.
but in the power of your own choices?
That's the question.
That's the question.
To ponder.
It's a journey worth embarking on,
Absolutely.
and it's a future worth fighting for.
Couldn't agree more.